Hello everyone, thanks for tuning into this video. My name is Valerie Wan and I am a student pharmacist in my last year of pharmacy school here at the University of Pittsburgh. I, along with two physician assistant students, collaborated on this series of blood pressure informational videos. In this video, I'll be talking about blood pressure medications and the importance of taking these medications once they are prescribed to you. First, we will talk about when it may be right for you to start a blood pressure medication. You and your doctor may start discussing whether it's appropriate to start taking medications for your blood pressure. For some people, lifestyle changes may not be enough to adequately control their blood pressure. When you start a blood pressure medication depends on several factors. First is how high your blood pressure is. Those with elevated blood pressure, which is usually measured between 120 to 129, over a reading of less than 80 are usually not prescribed unless they have additional risk factors. Some of those additional risk factors are older age, male sex, being overweight, smoking, diabetes, high cholesterol, and having high blood pressure run in the family. Those with a blood pressure reading of 130 or more, over 80 or more, may be determined by their doctor to require prescription medications. Some other factors that you may discuss with your doctor are about whether you will get a sizable benefit from taking these medications. Medication adherence is an important term to know. It basically means to take your medication correctly as directed by your doctor. If your doctor gives you a prescription of a medication to take once daily, then it is important to take it once daily. Medication adherence means remembering to take the medication on time, and also means getting your prescription filled on time and picking it up at the pharmacy by the time you run out. Understanding the directions of your medications are important too. Talking to your doctor and your pharmacist about the directions of your medications can help you better understand the best ways to take it that work best for you. There are many tools and tricks to use if you need help to remember taking your medicine. A pill box helps you remember to take your medicine by organizing your pills, generally by the days of the week and sometimes also categorized by morning and evening. You can also set an alarm on your phone to remind you to take the medication, since it's important to take it at the same time each day you take it. Another helpful trick is to store the medication in a place where you'll more easily remember to take the medication. This could be your nightstand or desk, so whatever is accessible and allows you to remember better. There are also apps available to help you with medication adherence, such as one called MediSafe, which gives you a personalized reminder for your medications to help you take control of your regimen. Adherence to taking medication correctly is important, since poor adherence means blood pressure cannot be adequately controlled, and this can lead to increased risk of complications of heart attack, stroke, and hospitalizations. Therefore, if you are adherent to your medications, this will significantly reduce those risks. So what happens if you miss a dose? First, don't panic. If you forget a dose, take it as soon as you remember. But if it is almost time for your next dose, skip the missed dose and go back to your regular dosing schedule. Do not take 2 doses to make up for the missed dose. Just get right back on track. Often, directions for when to take blood pressure medications generally say take 1 tablet by mouth daily. It's important to take the medication at the same time every day. So if you take it at 9 p.m. usually, it's best to continue to take it every day at 9 p.m. Something to take note of is that some information has found that blood pressure medications taken at night before bedtime may be more effective than taking it other times in the day for adults over 55 years old. This does not mean you have to change when you take your medications though. Your doctor may mention the most preferred time that you can take your medicine. Otherwise, take your medicine at a time that you remember best. If that means you remember best first thing in the morning with your breakfast, then continue to do that. If you are not sure when to take your medication, do ask your healthcare provider. Thank you for listening. We hope this video has been helpful for you, and we also have a video on general blood pressure information and a video on ways to lower your blood pressure without medication on the Wellness Pavilion website and Facebook page, so be sure to check those videos out too.